Hello, my name is Jerrod Keith. I'm a plastic surgeon and clinical assistant professor of surgery at the University of Iowa Hospitals and Clinics. Today we're going to be talking about hernia repairs and soft tissue reconstruction. There are 3 points of our talk today. The first is that hernia repairs and soft tissue problems often coexist. Second, both of these surgeries can be performed at the same time here at the university. And finally, we're going to talk about our overall goal of achieving a smooth abdominal contour as well as healthy overlying soft tissue coverage. Excess skin and abdominal hernias often go hand in hand, while most of the work involved with hernia repair goes on with the deeper muscular layers of the abdominal wall. It's also important that we have a healthy overlying soft tissue coverage for the hernia repair. Both are important, and proper healing and successful outcomes depend on these both working together. In general, there are 2 types of soft tissue or skin excess related to hernias. The first is found in patients with extra soft tissue of the lower abdomen. This can be bothersome for patients before and after surgery. Symptoms typically involve back pain, rashes, and difficulty with daily activities. Additionally, it can cause problems with wound healing after surgery. If indicated, we can treat this lower abdominal soft tissue excess by removing it at the same time as the hernia repair. This portion of the operation is known as a paniculectomy. The other common situation arises in patients with very large hernias or those who have had previous infections or wound healing problems, perhaps from prior hernia repairs. We typically find these patients are left with very thin skin or even just scar tissue. As we repair the hernia, the abdominal wall becomes tighter and flatter. This results in loose extra skin or scar. The final step of the operation is to remove this poor quality tissue and to close the incision with healthy skin. Finally, occasionally there are special circumstances where patients may require more complex reconstructions with procedures known as grafts or flaps. These may be necessary for more difficult reconstructions and are determined on a patient-by-patient basis. However, we are ready and capable to perform these operations as needed. Overall, we want patients to know that every hernia operation, our goal is for patients to have a smooth abdominal contour with healthy, overlying soft tissue. Please call me at the University of Iowa Hospitals and Clinics, and I would be happy to answer your questions about soft tissue reconstruction and hernia repair. There is nothing routine about hernia surgery, and that is why we have a dedicated team of surgeons from multiple specialties to ensure the best treatment and care is provided to our patients.